Good afternoon students, I am Avinash, Assistant Professor, Chitkara University College of Nursing. So today we are going to discuss about ECG. ECG is electrocardiography. So it is a very basic concept. Today we are going to discuss about the basic concept about ECG. So firstly, we should know what is the conduction system of heart. So conduction system of the heart is the electrical system of the heart. So in which there is a SA node where firstly the current travels toward the atria and atria will contract, and then it passes to the AV node, and from the AV node it passes through the bundle of his and then goes to the left and right bundle branches and then Purkinje's fiber, and then the ventricular depolarization occurs. So this is the conduction system of heart. So let's start the introduction of the ECG. So ECG is a non-invasive painless diagnostic test, okay? And it records electrical impulse of the heart. The electrical impulse of the heart that is generated by the heart, it is recorded by the ECG, and the standard ECG is a 12-lead ECG. We have more comprehensive ECG available in the hospitals like 15-lead ECG and 18-lead ECG for further assessment. And the ECG is recorded by placing the electrodes in the standard positions. There are some standard positions. There are some limbs electrodes and chest electrodes. The chest electrodes be applied on the chest and the limb electrodes be applied on the limbs. So let's start from the definition. So definition of the ECG is: the ECG is a graphical representation of the electrical activity of the heart. Okay, so the electrical activity of the heart that is generated by the heart is graphically represented in the ECG by the ECG machine in the in the ECG paper. So this is ECG. Next are the indications. So what are the indications? The first indication is a cardiac dysrhythmia. If the patient has cardiac dysrhythmia, for example ventricular tachycardia, ventricular fibrillation, atrial fibrillation, atrial flutter, supraventricular tachycardia. So for these situations we have to do ECG. Next is the relative, to find out the relative size and position of the heart. If there is any hypertrophy occur in the heart, so physician can recommend this test. Next is conductional abnormality. If the patient has a conductional abnormality, then ECG should be recommended. And last one is myocardial infarction. Myocardial infarction simply is heart attack. If patient has a CAD, angina or myocardial infarction, so we have to do the first test is the ECG in the cardiology. Next, come to the parts of the ECG machine. So these are the some parts of ECG machine. First, this is the ECG machine and electrodes here, and this is the ECG cord. So these are the some parts of ECG machine. Next is electrodes of the standard 12-lead ECG. What are the electrodes that we apply on the chest and limbs in the 12-lead standard ECG? So it is divided into two, that is chest electrodes and limb electrode. In the chest electrodes there are total 6 chest electrodes, names from V1 to V6, V1, V2, V3, V4, V5 and V6. And limb electrode, there are 4 limb electrodes present in our all limbs. These all, so total electrodes are 10 electrodes. These all electrodes record the 12 leads of ECG, means different view of the hearts is recorded by these electrodes. So this structure showing the electrode placement for the ECG. So these are the spot where we can apply the electrodes. So chest electrodes be applied on the chest. V1 apply on the right side to the sternum in the 4th intercostal space. V2 apply opposite to the 4th intercostal space, and V4 is apply on the 5th intercostal space at the level of mid-clavicular line. After applying fourth electrode, we apply the third electrode horizontally to the V2 and V4, and then we apply V5. So the position of the V5 is fifth intercostal space at the level of anterior axillary line. And next is last chest electrode is V6 electrode, and it apply in mid axillary line at fifth intercostal space. So limb electrodes, we can apply limb electrodes on our hands and our legs. There are four limbs electrodes. Red color electrodes apply on the right hand, and the yellow one is applied on the left hand, and the black color electrode apply on the right foot, and the green color electrode apply on the left foot. So this is the standard ECG paper, where in this paper the ECG is recorded. ECG waves are recorded and interpreted by the physician or a nurse. So in this paper there is small boxes and one big box. So one big box contain total, horizontally contain 5 boxes and vertically as well as contain 5 boxes. So next come to the waves of ECG. So these are the waves of ECG. When our heart, when SA node triggers the electrical impulse towards the atria will contract. Okay, and when atria will contract, P waves form. So first wave is a P wave, this is a small waves, and this is last one is a QRS complex, and last one is T wave. So first one is a P wave that represent atrial depolarization. Next one is QRX. So these 3 waves represent the ventricular depolarization, and last one is a T wave. It represents ventricular relaxation, means ventricular repolarizations. Next, so this is the P wave. The P wave represent atrial depolarization and the in sinus rhythm. Sinus rhythm means all the electrical impulse generated from the SA node. So this is called sinus rhythm. So there should be a P wave proceeding every QRS complex. Next is QRS complex. So QRS complex represent depolarization of the ventricle, as I discussed earlier, and it measure from the beginning of the Q and at the termination of S wave. And next is it follow the P waves. It should always follow the P wave into 1:1. The normal QRS duration is 120 milliseconds. This is the normal QRS duration. And next, last wave is a T wave. So T wave, I already said that T wave represent the ventricular repolarization, means relaxation of the ventricle when the ventricle is filled up. So it is seen as a small wave after QRS complex. So it forms in a after the QRS complex, and it is inverted in AVR. In AVR rate, it is inverted. So thank you very much. In next lecture, we will discuss about interpretation of ECG. So thank you very much.